If you are a teen with irregular cycles, you have a little bit of acne, maybe you're gaining some more weight, that can be very, very normal for your age category because our bodies are naturally transitioning, especially if you got your period recently. It can start off very sporadic and it can actually take in between 2 and 10 years for you to have a regular adult cycle. So this means that you might see more irregular periods. Maybe your cycles are 45 days long. That can actually be completely normal. You might actually see polycystic ovaries on ultrasound if you do get it. And again, that can be normal for your age group. You likely are not ovulating as regular as you would if you were having more mature cycles. At this time, we might have slight insulin resistance, meaning that when you eat food, maybe your body releases a bit more insulin, it's not responding to it as well. And that is, again, very normal in those puberty teen years. Your body does that because it wants to put on fat to help you achieve pregnancy and to be able to keep a pregnancy. And even though you might not want it, that is our body's just biological thing that it wants to do. And it does that by making you slightly insulin resistant. Now, when you're trying to diagnose PCOS, those are all things we really look at. That's why it's so hard to diagnose in teens, because that can actually be normal, where your doctor might run these tests and be like, oh, you have all this, you might have PCOS. And you might have PCOS, but we really need to make sure that we're getting a correct diagnosis. And that's why the criteria is a bit different when you're looking at teens as opposed to adults. At this time, we can also have more androgens going on, higher testosterone. We can see those breakouts and things like that. So generally your cycles should level out after a while. Your brain and your ovaries will create a better connection. Your cycles will become more regular and you should be able to see that progress. If you're not seeing that in future years and it just continues to be regular, you're having very clear signs, then yes, please go get checked out. Either way, if you feel you need to go get checked out, please do.